Welcome to today's webinar, hosted by Engaged, the National Resource Center for Engaging Older Adults, which is administered by US Aging. My name is Meredith Hanley. I serve as the Director of Community Capacity Building at US Aging, and I oversee the Engaged Resource Center. Our webinar today is called Social Engagement in Housing, Effective Programs, Activities, and Partnerships. During the webinar, the American Association of Service Coordinators will discuss social isolation within senior housing and how aging network organizations can partner with housing communities to promote social engagement. Attendees will also hear from Aging Ahead and PEP Housing on programs and activities that promote social connections within senior housing. And all speakers will provide tips for organizations interested in developing programs and activities to address social isolation and loneliness in housing communities. Next slide. Just a few brief housekeeping items. All attendees of this webinar are in listen-only mode for the duration of the webinar. So that means your microphone or phone will be muted, but there are still ways you can engage with our speakers today. You can submit questions for the presenters at any time during this webinar by clicking the Zoom question and answer button at the bottom of your screen. So just type in your question in the Q&A box and hit submit. We will save time at the end of the webinar to address some questions. There's also the chat feature. You can click on the chat button to submit a message to us as the host if you need technical support or to engage with each other. The webinar will be recorded and we will share a link with you in the next few days. Next slide. For those who are using a screen reader and want to silence any unwanted chatter in the chat and Q&A boxes, you can activate the speech on demand feature by pressing insert spacebar and then pressing the letter S on the keyboard. Anyone can view closed caption subtitles, watch a live transcript of the meeting, or adjust the size of subtitle text. So to control the closed captions, click on the CC button at the bottom of the screen, at the bottom of the control bar in the Zoom window. And also, if you'd like to notify us that you need technical assistance, you can raise your virtual hand. And you can do that using the Zoom platform or press Alt+Y on your keyboard to raise your hand, and we'll do our best to help you. Just a little bit about my organization. Next slide, sorry. US Aging is the national association representing and supporting the network of area agencies on aging and advocating for on behalf of the Title VI Native American Aging programs. US Aging has a number of initiatives that can be found on our website, usaging.org. We administer, for example, the Aging and Disability Business Institute. We co-lead the National Aging and Disability Transportation Center with Easter Seals. We lead Dementia Friendly America. We operate the Elder Care Locator and Disability Information and Access Line, and many more efforts as well. And again, more information can be found on our website, usaging.org. Next slide. This webinar today is convened by Engaged, the National Resource Center for Engaging Older Adults. US Aging administers Engaged. Engaged is a national effort funded by the Administration for Community Living through a cooperative agreement, and Engaged works to increase the social engagement of older adults, people with disabilities, and their caregivers. Much of our work focuses on identifying and disseminating information about emerging trends. We develop a variety of resources, replication tools, best practices for social engagement programs. I'll touch on some of those at the very end of this webinar. Engaged is guided by a project advisory committee with representatives from 18 different organizations and resource centers who help to guide and shape our work, providing insights on social engagement from their fields of expertise. And we have a website, engagingolderadults.org, where you can find out much more about Engaged. Next slide. I'm very excited to introduce the speakers for today's webinar. We're joined by Nina Santarelli, Senior Director of Strategic Partnerships with the American Association of Service Coordinators, Bonnie Lococo, Community Options Specialist with Aging Ahead, Margie Valeroy, Community Options and Services Manager, also with Aging Ahead, and Marilyn Buono, Resident Services Manager with PEP Housing. So with that, Nina, I will turn it over to you.
Thank you, Meredith. As Meredith said, I'm Nina Santarelli. I'm the Senior Director of Strategic Partnerships at ASK. Next slide. ASK supports service coordinators working in affordable housing across the country. These service coordinators are funded by HUD. HUD currently is funding a little over 6,000 service coordinators working in senior housing, mostly in multifamily or under the Ross program. There are additional service coordinator positions that are funded through tax credits, and there is exciting a $25 million NOFO that was announced in 2021 that will fund some additional service coordinator positions. Next slide, please. So the American Association of Service Coordinators is the national association that essentially provides support to service coordinators that are working primarily in senior housing. We currently have close to 4,000 members across the country. We represent 1,000 member organizations. And as I mentioned before, our primary goal is to provide education and advocacy specific to the service coordinator program. We do that through annual conferences, through our webinars, through Ask University, which houses our on-demand courses that service coordinators have access to, and then the professional service coordinator designation, which we offer through a partnership with Ohio State University. Next slide, please. So service coordinators, I think a lot of times people interchange service coordinators with case managers and care coordinators. So I wanted to take a second, I guess, to really define what service coordinators are and what they do, and how, if working with a case manager and a care coordinator, they truly can be a powerhouse for the people that we're serving. So service coordinators are primarily focused on the social determinants of health. They are doing assessments, but their assessments are not clinically based. So they're not looking to diagnose anybody. They're not looking to get too in the weeds with health information. They do ask health specific questions, but that's more for the purposes of kind of getting a better understanding of what's going on with the particular resident, so that they can assist them with meeting whatever needs might be coming up for them. So their caseload primarily consists of the residents that are living at the housing site that they work out of. HUD does say that they can assist people working in the community, but oftentimes service coordinators don't have the bandwidth to be working with anyone outside of the housing property, and people in the community often don't know that they're there as a resource if they wanted to reach out to them. But their primary role is to assess the resident, work with the resident if they've got something going on that they need assistance with, to link them with either traditional or non-traditional service partners in the community. So they're not providing any sort of direct service. They're simply making a referral to help ensure that that resident can age in place. So typically these service coordinators are employed by housing organizations, sometimes social service providers. You may see a service coordinator like at a firehouse or something along those lines, but for the most part, it's within a housing organization. So that's different in the sense of case managers are more focused on typically providing or assisting with direct service, and care coordinators obviously are focused on more the clinical aspect of things. But I said before that, you know, if they're working together, they can truly be a powerhouse for those who are aging in place. So a service coordinator may, like through their assessment process, identify that a resident has, let's say, diabetes, and that resident has indicated that they don't feel their meals are balanced and helping them in any way to sort of manage this chronic health condition. So the service coordinator may make a referral to their local area agency on aging, where a case manager can get involved and assist the resident with maybe getting Meals on Wheels or whatever else may help them to be able to, you know, obtain nutritious meals and all the things. And then they may also make a referral to a care coordinator, where they are able to help that resident sort of hone in on what is specifically going on with them and help them to better manage their chronic health conditions. So the service coordinator essentially just is the conduit to the people who are able to provide more in-depth service for a resident. Next slide, please. So wanted to quickly highlight, so HUD does have a resource guide that sort of outlines everything a service coordinator could and should be doing. But one of the main pieces that I wanted to make sure I highlighted today was the core functions that HUD says a service coordinator should be doing. So they say that they should be conducting comprehensive assessments, identifying and accessing services that will assist that resident with aging in place. They are supposed to be monitoring any referrals for service that they are making to assist that resident aging in place, so that if a resident fires a home health aide or a service stops for whatever reason, or maybe they never connect, the service coordinator can kind of help facilitate either a new connection or reconnection if that's necessary. They are expected to proactively arrange education and wellness programs. And they're also expected to develop and sustain partnerships with community-based service providers. And then, of course, sort of maintaining a resource directory so that if the service coordinator is not there, the resident still has access to the same resources that a service coordinator would offer if they chose to work directly with a service coordinator. So that's done through the resource directory. Next slide, please. So it's important to know who the service coordinators are. So if you're working, maybe you're a case manager or a care coordinator, if you're working with individuals who live in senior housing, knowing whether or not there is a service coordinator at that particular individual's property is going to be super helpful, because that service coordinator can be extremely helpful to you in terms of, ensuring that you get the connections with the correct people. You may have the opportunity to expand your connections with residents. The service coordinator is really there to ensure that there's greater success either with programming or with just, connecting with individuals. They also can help you sort of create a collaborative environment. Because the service coordinator works at the property, they obviously have already taken the time and have a established relationship with the residents that are working at the site. So they are a trusted face. Oftentimes residents will look to the service coordinator for guidance on whether they should attend a specific program or whether a service provider that maybe they've heard of or are interested in is reputable. So the service coordinator is going to benefit you in the sense that the residents are going to be trusting of whatever it is the service coordinator is recommending. The service coordinator can also help reduce fragmented services. So if maybe somebody is coming to visit a resident, while the service coordinator isn't necessarily responsible for reminding a resident that they have an appointment coming up, they can sort of just touch base with that individual as part of their monitoring practices to, make sure connections are happening, or, help the resident put a plan in place to ensure that they don't forget that somebody's coming to see them. And then, of course, increased compliance results in increased financial stability just for everybody involved. But also it helps it helps other community agencies develop resources, but it's also assisting the service coordinator with sort of expanding the resources that are available to their residents. Next slide, please. So I mentioned earlier that service coordinators are conducting assessments. Wanted to call attention to two specific assessments that if the service coordinator is using Ask Online, which is the web-based documentation system through Pangea Foundation, they have access to two evidence-based assessments. The first one is the loneliness scale, which is the UCLA-3. It essentially just asks 3 questions about companionship, feeling left out, and isolation. Excuse me, this assessment, again, is not intended to provide any sort of diagnosis or anything like that. It's really just an additional piece of information that the service coordinator has access to. So if, let's say, a service partner is coming to the property and they don't have great registration for a program, for example. The service coordinator can sort of use that information that they've gathered from doing these assessments to make pointed efforts to invite residents to attend programming, or if they've got a specific chronic health condition, using the assessments that they've done to make sure that the people who are impacted by said health condition are able to attend or at least have knowledge of this event happening at the property. The other evidence-based assessment is the Lubin Social Network Scale, which is a series of 6 different questions that really focuses on relationships with relatives and friends, and who the resident identifies as a trusted support person in their life. And again, this allows the resident or the service coordinator to really figure out who has strong support systems in place and who could benefit from additional engagement opportunities that maybe they don't otherwise have access to. Next slide. So as I mentioned, we're the National Association, but we're always looking for partners, and we have several partners that we work with currently, just to sort of help service coordinators make the connections that they may not have already made. Locally, I think service coordinators have a really solid understanding of what's available around them, but maybe there's national resources that are available that service coordinators don't always know about. And so ASK does their best to try and share that information with service coordinators. And we do that through a number of different ways. But oftentimes, partners that we're working with will host informational sessions where our members can, attend a meeting similar to this, where that partner is sharing information and resources about how they assist residents, or, if they've got things going on, a local contact that maybe somebody could reach out to better assist with getting a resident's needs met. We are currently exploring working with a data-driven company that essentially what they do is, through a series of specific assessments, will sort of help the service coordinator and or property develop a social quotient, is what they're calling it, which will help them sort of customize their ability to create connections within their specific community. So it's all very specific to what's going on with that particular property. As many of you know, properties change, so the personalities of the properties change, the needs change. So over time, as things continue to evolve, this social quotient essentially helps the service coordinator sort of keep a pulse on what will work presently versus maybe what was working before but isn't any longer. And then of course, we're always looking to participate in research studies to sort of help outline the impact that service coordinators are having at their properties and with their residents. So if any of you on the call today are interested in speaking more with me, I would definitely welcome that conversation. Next slide, please. And that's all I have. So I am going to pass it over to Aging Ahead, which is Bonnie and Marky. Thank you.
Thank you very much. Nina, we appreciate that. And Aging Ahead is an area agency on aging, and we are actually located in St. Louis County. We serve St. Louis County as well as 3 surrounding counties. And the program that we have, we've named Aging Ahead at Home, bringing resources to your door. As you can see in the picture, we're literally doing that in that picture. With this program, we are at 7 locations currently, and some of those are villas, as shown in the picture, and others are apartment buildings. The number of residents in the apartments range from 45 to about 125 when they're all fully occupied, which of course in affordable housing is most of the time. Next slide, please. I wanted to tell you a little bit about the history of the program and how we became involved in this. It really started when our executive director was at a meeting of service providers of programming for older adults. And there was also a developer there who was interested in building some apartments for older adults, some affordable housing. And they had a conversation. He was going to be, the developer was going after some tax credits and had this idea that if they could add a social service arm to their application, that they were probably more likely to receive the tax credits. And they were right, and went ahead and asked us to be a partner with them. So we became a partner, and they did get the funds. And I will say that every application they've done after that time, we have partnered with them. That was back in 2013. Took a while, of course, for the application process to be completed, and then for the building to be completed. And by 2016, the complex was fully occupied, and we were on the road. We were underway with business and had our first MOU with that developer. Since then, we have partnered with them multiple times. They have expanded a couple of their locations, added other wings to their buildings, and they've asked us to be a part of those applications, as well as when they have developed new places. They've asked us to also be part of those applications, and they've continued to receive the tax credits that they've gone after. And since then, other places, other developers have also included now this social service arm to their applications. And we currently are now, as I mentioned, in 7 apartment developments in 3 of the 4 counties that we serve in our area. Next slide, please. So when we started out, we thought about what would really be the goals of a program like this, and combating social isolation, of course, became a major focus. And I'm going to not really discuss that much. Bonnie's going to talk about that in detail. But meeting consumers where they are, obviously, this is their home. This is where they're living. So we're bringing our resources right to them, to their door, if you will, and also expanding the access to services. Our staff who are located at these apartment complexes are all professionals who we also have as our community options specialists. And a requirement of being a community options specialist at our agency is that they have a minimum of a bachelor's degree in a social service field. So our staff have either a bachelor's, a master's, some have licensure. So when they go out to the apartments, they are able to do the assessments. They are familiar with community resources. They create programming that is making people more aware of the services that are there in the community. I can't help but mention that it also has created a revenue stream for our agency. And I honestly think when we started the program, that was a time when we really needed to give some serious thought to that, when we were seeing a cut in the funding that we were receiving. And currently, our income from the program is about $6,000 a month. And I expect that will continue to become larger as we add certainly more apartment complexes to our program. And certainly as we increase the amount that we're going to have to charge places for our services as well. Bonnie is going to talk about social isolation and how we are attempting to combat that. Bonnie is one of our community options specialists who also is at one of our locations and working with the residents right there on site. Bonnie?
All right, thanks. So I'm going to talk a little bit about combating social isolation and what we do. I am Bonnie. I'm with the Aging Ahead. I'm a community options specialist. So one of the ways that we do that is to create a newsletter that we put out once a month at the beginning of each month to all the residents at the apartment complex. So we try to include topics that are timely and trending. Like for instance, around this time of year, we've had articles on, budgeting money during the holiday season. In January, we might talk about New Year's resolutions and what kind of resolutions seniors might try to focus on. or want to focus on. And also in the beginning of the year, we usually put out an article and information about applying for the property tax credit, which is something that we have here in Missouri for folks that are either disabled or over the age of 65. So we also include in the newsletter information about their local senior center. We try to include a calendar of their activities that they do and the lunch menu that they have. And in addition to those things, the articles, the senior center calendars, we also usually include a recipe for the month that is also distributed to the home delivered meals folks, and puzzles. Folks like to do those kinds of things, crossword puzzles, word search, that sort of thing. And then we include a flyer or a little blurb in the newsletter if we have an event coming up that we've had scheduled. So we usually distribute right now, since we're in the 7 different apartment complexes, we distribute about 600 newsletters each month. And we try to have regularly scheduled activities, both educational and social, at least once a month. So we might do an educational event like fall prevention with the local fire department, recent scams with the local police department representative, or social events like I've done board games with Bonnie. One of our other community options specialists did Aging Ahead bingo. One of the complexes had a barbecue for their residents so that the residents could kind of get to know each other, get out of their apartments, and then meet us so that they, know who we are, because we do put our names and phone numbers on the newsletter, but unless somebody comes into the clubhouse where we are or goes down to the office to see the community options specialist, they may not know what you look like. So that was a good way to get people out and to meet us. Some of the other activities we've done that have been most successful are trivia with the community options specialists. We talked about diabetes, Alzheimer's, holidays, also having an elder law attorney come in and talk about maybe power of attorney, end of life kind of stuff, or just ways to get your healthcare directives and things in place, recognizing scams with the local police department, like I mentioned, and having a representative from Missouri Rides come and talk about the different transportation options in the area. So our COS, community options specialists, are available on site 2 days per month, and we're usually either in the leasing office of the apartments or in the apartment building itself, near the office manager or the apartment manager's office. And we're there from 8 to 4:30. We also are available by phone when we're not on site. Like I said earlier, we usually put, we always put our phone number on the newsletter, and also, what days we're available in that particular month. We usually average 1 to 2 calls a month from our residents when we're not on site. And that was certainly something, during COVID from March 2020 to August 2021, we weren't on site, we were working remotely. And so we did continue to pass out our newsletters, and also we're available to residents by phone. Next slide, please. So I know the print is kind of small, but this is a copy of an example of one of the newsletters that we put out recently in October. So you can see a picture there of our community options specialist, Jill, who happens to be at this particular complex. And we had information about student loan forgiveness. And we always include our senior Medicare Patrol fraud fact for the month. And then it was open enrollment coming up. So we also had information about Medicare open enrollment that month. Next slide, please. And we included some information that a resident could put down to help keep track of their medications in case of an emergency. There was information about getting vaccinated for COVID-19, more information about Medicare. She had a calendar there and circled the dates that she was going to be available on site. And then she had an event that month about Aging Ahead bingo, so that the residents could come and learn more about what we do at Aging Ahead, what services we offer and programs, while, you know, playing bingo and having a good time. Next slide, please. So some of the lessons learned while going through this and being in the apartments is, you know, we have to remember that the apartments are homes for the folks that we're trying to reach, the residents that we're out there to serve. You know, and sometimes they don't want to leave their homes. You know, they're comfy in their home. They don't want to go out. Maybe the weather's not the best and it's cold, or, you know, COVID kind of left some effects on folks being comfortable out in community and not being comfortable being around other people. So we just try to be persistent in our efforts to get them out of their homes and continue to invite them to our events and to come and learn, or just to come and have some social activities with the other residents. We know that, you know, social isolation is not good for people's mental health and physical health. So we want to try to get them out. Also, another lessons learned is, you know, trying to find timely and trending topics for our newsletter and for our programming to keep it interesting and be able to share information with the residents that, you know, would be important for them. We also have to have a buy-in with the management team. So we work with them closely on, you know, the events that we schedule. The apartment managers also put out a survey to the residents when their recertification comes due every year, to try to get information about what the residents are interested in, what kind of topics they would like to know about. So that's very helpful for us to try to schedule our events and know what our particular apartment residents are going to be interested in. You know, education can be done in a social setting as well. So, you know, like playing games with the residents or playing cards with a group of folks that come in, having coffee with the residents. There's a group of ladies that come into my apartment where I am, and they play cards or play games together. So I've gone out there and played games with them. And, you know, while we're talking and having a good time, we also, then I can throw out some things that they might not know about, that they might need to know about, things going on in the community or things that we do at Aging Ahead. So we can provide that kind of education. And we all know that people are typically motivated by food and fun and things that are free. So, you know, if we have the resources to try to include maybe some sort of snacks or something like that when we're having an event, that's a great way to draw people out of their homes. Making it fun, like when we've done bingo or trivia, you know, those events seem to draw a greater number of residents. And, you know, all of the events that we put on for the residents in the apartments are free. It doesn't cost anything for them. We try to find folks that'll come and do a presentation or something at no cost. So, you know, that is helpful as well. Next slide, please. So that's just the information, contact information for Margie and myself. Feel free to reach out to us if you have any questions about what we do. And I'm going to pass it on to Marilyn now. Thanks.
Thank you. My name is Marilyn Buono, and I am a program manager for PEP Housing. PEP Housing has been in existence for almost 40 years. And for the resident services department, there's a total of 6 full-time staff, including myself. We are currently located in Sonoma County, Mendocino County, and Butte County. PEP Housing provides quality, affordable housing to limited income older adults with support services. And the role of the service coordinators was discussed earlier at length, and that's what we do for our residents and for our communities. For this morning, I will be talking about one of the many programs, services, projects, and activities that we initiate and implement in all of our properties so that our older adults remain engaged, which is the quilting. Next slide, please. So how did we do the quilting? We did implement the program to reduce social isolation among our residents through arts and creative expression, utilizing fabrics. Next slide, please. In this arts program, older adults live in our communities and they come together to practice their quilting skills for those who have the skills, and at the same time, integrate those interested individuals who are very interested to learn new skills and socialize while working towards a common goal. PEP Housing provided the participants with all of the materials for free, and we utilize our own funds and individual donations. Our older adults, who are the residents and volunteers, they work as a team. They decided on the design of what they need to create until they finish the product. Next slide, please. Here are the photos of a quilt that was completed in one of our residents and in one of our properties in Mendocino County. And right here, you can also see how we organize all the materials or the different squares that would complete a quilt, and they were all distributed. And we worked very closely as well with the property managers in each of our communities. Next slide, please. So how did we promote the program? We created all the flyers, posted them all in our common areas and on all of the residents' home to inform them about the activity. And just like what I mentioned earlier, we work very closely with the rest of the staff that are also present in the property to promote and inform them about the program. And then we created a list of all of those who are interested. And that's how we started a group in every PEP community. Next slide, please. So we focus on the program on an art activity like quilting to motivate our older adults to engage, interact, and work together to create a work of art, to ensure that participants are comfortable gathering in person with their mask, of course, and the quilting activities are held in a small group settings to make sure that they feel safe. Once all of the squares are complete and the quilts are made and sewn together, they are then sold and auctioned off to raise money for future projects within the community. Next slide, please. Here are more of the photos of the quilts that were completed in 2 different locations, which is in Santa Rosa, Acacia Lane Senior Apartments, and the Sun House Senior Apartments in Ukiah, which is located in Butte County. Next slide, please. So who are the partners and what resources did we use? The quilting program relies mainly on many volunteer residents, as well as their friends and family members who were willing to provide their time to assist in the quilt making process. The quilting program does not require many materials if you're able to solicit donations in cash or in kind. It's mostly resident driven, requiring a very minimal staff time, and relies on recycled materials such as old clothing. Our residents are very engaged, and according to their interests and according to how much time they devote to the program, I would say that it was very successful. Next slide, please. So here are the outcomes. The participants of the program have developed new friendships and maintained established social connections in their community. And at the same time, it has benefited the time and the hard work that participants dedicated to crafting the quilts that help raise the funds for their community. Next slide, please. Here are more of the quilts that were completed when we did the Quilting for a Cause program. As you can see, they're so beautiful. A lot of love was put into these quilts. Next slide, please. Quilting, the lessons learned from the activity. Quilting is a very popular arts and craft activity, as you must have known, and it has been in existence for quite a long time. Many older adults are very skillful, and they are able to assume active roles in teaching others about the quilt making process. The program has garnered a lot of interest and has helped some participants learn new skills, all the while requiring minimal staff assistance. Next slide, please. Thank you for your time and hope you enjoyed our quilts, and feel free to reach out to us if you need more information. Now let's turn it over to Meredith. Thank you.
Yes, thank you. And those were beautiful quilts. Thank you to all of our speakers. That was really, really helpful. I'll share some brief resources and then we'll come back on as a group for Q&A. First is a little information about the Housing and Services Resource Center. It's a joint initiative of the U.S. Department of Health and Human Services and the Department of Housing and Urban Development, or HUD. They have a website for this resource center, which can be found at acl.gov. You see it on the slide here, /housing and services. Next slide. The Housing and Services Resource Center works to facilitate a federally coordinated approach to providing resources. They do learning collaboratives, training, and technical assistance to improve access to affordable, accessible housing and critical community services. The center works to cultivate partnerships that bring together multiple sectors, especially sectors like housing and homeless service systems, the aging and disability networks, and the healthcare and public health systems, with the aim of fostering the ability of people with disabilities and older adults to have stable housing and be healthy and active in their communities. Next slide. And this is a snapshot of some of the content that is on the Housing and Services Resource Center website. So we just wanted to share that resource as that resource center as a resource for you all today. Next slide. I also wanted to share a little bit more about the Engaged Resource Center and some of our kind of latest or key resources. We have a new publication that recently launched in partnership with Older Adults Technology Services, also called OATS, titled Implementing Hybrid Programs, Considerations and Best Practices for Aging Network Organizations. And it has key considerations, tips for organizations, best practices for developing and administering hybrid programs. So programs that are being run both in person and virtually at the same time. We also have a recently updated community awareness toolkit with new and updated materials. It has a variety of customizable materials like a consumer brochure, various infographics, fact sheet, sample PowerPoint presentation. So if you're looking to raise awareness about the importance of social engagement to your audiences, some tools in there may be helpful for you. And we have an array of other resources and materials, including our Social Engagement Innovations Hub. We also have a variety of consumer-focused brochures, and we do a monthly newsletter and blog, all of which can be found on the website engagingolderdults.org. Next slide. I also wanted to briefly highlight another initiative called Commit to Connect, which is a campaign developed by the Administration for Community Living to combat social isolation and loneliness. That initiative is working to foster a nationwide network of champions at the local, state, and national levels who are committed to addressing social isolation and loneliness and networking with others who care about this issue as well. Champions sign up for free to an online networking platform and then have opportunities to engage in online discussions and participate in opportunities through Commit to Connect. US Aging serves as the coordinating center for that initiative. So you can find out more info on Commit to Connect at committoconnect.org and perhaps consider joining the nationwide network of champions if this is an issue that's important to you. Next slide. So now we have a little over 10 minutes left for Q&A. So I'll invite all the panelists to come back on the screen. You can turn on your cameras and I'll kind of lead us in a little discussion here. So let me look through the questions. Let's start with Nina. This is kind of a broad question, but just, from your presentations, we know that service coordinators do a lot. They sound like busy folks. If there's anybody in kind of listening in today that's perhaps interested in partnering with one of their local service coordinators, do you have any tips for how they could go about that, kind of how to partner in a way that also makes it easy and an interesting opportunity on the service coordinator side?
Sure. So I would say, first, kind of figure out who the service coordinator is, and you can reach out to them directly to start a conversation. Typically, we would suggest that agencies that are nonprofits or aren't really charging for their services be the type of partners that service coordinators are seeking out, simply because residents are obviously limited in their income. But the opportunities are going to be specific to whatever that service coordinator's agency allows. So opportunities may vary from one site to another, depending on what the policies are of that particular organization. But if you're interested in partnering with the service coordinator, I would definitely just encourage you to have that conversation, get a sense of what their residents' needs are, and figure out how the two of you may be able to work together to provide social opportunities or maybe be able to assist residents with aging in place.
That's great. It's kind of on that note about no cost opportunities. And this could be for Nina or really any of the speakers, I think, but a person had asked, what are your policies or maybe just protocols regarding bringing people in to do activities that provide education, but might also have a goal to sell something to the resident or the older adult, such as insurance brokers. So are there any kind of standard practices or guidelines that y'all tend to follow? And maybe I'll start with Margie or Bonnie if that's come up on your end.
Sure. What we will only allow or invite someone to come in if we would invite them to come in to one of our senior centers, one of our community sites. And anyone who would come into one of those locations would have to be vetted, to go through a process here at the agency in order to do that. Yeah, we're not going to bring somebody in to sell insurance.
Yeah. Yep. Good information to share. Nina or Marilyn, anything you'd like to add on that one? Or general agreement, perhaps? Yeah, I see a head nod. Sorry, go ahead.
If it is for profit, we are not encouraging those types of presentations. We utilize generic and different levels of service providers in terms of their services and programs that will benefit our residents.
Great, thank you. That's helpful. This question, so I guess stay unmuted, Marilyn. This question is for you. Couple of questions for you. Somebody asked, how long does it take to complete a quilt? And then there was also a question with regard to the quilting project, what financial resources were available to support the program? And folks were just saying the quilts are very beautiful.
Thank you. First, for our resident services program, we usually have grant funding, and our executive director is very active in soliciting donations, grants that are available in our local communities. And for the quilt program and project that we did, friends, family members, they donated in cash and in kind. And in addition to that, as they continue to do their own quilts after we did the program, they utilize old clothing. So those would be the resources. And it doesn't take a lot of money really to put all of those quilts together. And the other question, I'm sorry.
It was about financial supports of the quilting project, and then how long does it take to complete an individual quilt on average?
Yeah, the length of time to complete a quilt depends on the design and the size of the quilt. You can start and finish a quilt in one day from a simple design in a very simple size. You know, the smallest quilt, you can do it in one day, and the most complex design and size would take a longer time, from 3 to 6 months.
Thank you. This question came in for Bonnie, and I don't know, Nina, you might have thoughts on it too, I guess from a national perspective. I wonder if there's data, but what percentage of persons you serve are using computers or online? Is Wi-Fi part of the rent at their residence? Bonnie, is that something you're able to speak to?
Yeah, so as far as the percentage of people that are using computers or online, I'm really not sure, but I'd say probably the majority of them are. And I think one of the apartment complexes that we're in does have Wi-Fi included in the rent. And that's probably because the office and the residence apartments are all in the same building, so they have access to the Wi-Fi. Whereas like the apartments that I'm in, I don't believe it's part of their rent. The leasing office is in a separate building. And so I think those residents probably have to get Wi-Fi on their own. I don't know, Margie, if you know anything about that in particular, but I just kind of looked on my apartment's website just to see if that was something that was mentioned that was included in the rent, and it didn't say anything about that. So I'm assuming that it probably is not.
And Marilyn, I see your hands up. Is that one you wanted to chime in on?
I can speak for PEP Housing that in all of our properties, we provide free Wi-Fi, and we have computers in common areas so that they can access it as well. And so we are a very small organization. And so we only serve more than 600 older residents with 6 full-time resident service coordinators. And so maybe, you know, because of the size of our organization, we're able to provide free Wi-Fi to all of our properties.
Yeah, I would like to add that there are a couple of computers available for the residents in the apartment complex where I am, in the leasing office, clubhouse, whatever you want to call it. So if somebody wants to come in and use the computer or use the printer or something like that, you know, they can do that, and it doesn't cost them anything to do that. So.
Thank you. Okay, I think we have time for 1 or 2 more questions. Nina, you had mentioned, I guess as an interest area and something that Ask is working on, research opportunities to demonstrate the impact of service coordinators. Could you talk a little bit more about kind of research in that space, just kind of briefly? And is there anything looking at their role in terms of potential impact on social isolation and loneliness, perhaps?
So we partnered with Harvard University recently to do a study on service coordination. It was more specific to the COVID sort of timeframe and just the increase in work and things that service coordinators experienced, and just the level of difficulty they had with, you know, keeping connected with residents and sort of assisting them with staying connected. To my knowledge, we don't have anything specific to social engagement, but we always are interested in partnering, and we will, depending on the level of partnership and what that partner has access to, sometimes they'll use insurance data. We obviously don't get, you know, access to that information, but they can use it as part of their study if they've got that level of access. And then through Pangea Foundation, utilizing the data that service coordinators are entering into their system, as well as resident conversations and things. So we essentially are the facilitator for our members who may be able to participate.
Great, thank you for sharing. I think, thank you. I think we can conclude the Q&A because we do have a couple of wrap-up slides. But so Allie, you can pull up the slide deck, and speakers, thank you for your time. You can, don't disconnect yet, but we wanted to give a couple final flags. First, there's a brief survey, which will be displayed in your browser after the Zoom webinar closes. We'd really appreciate everyone in attendance if you can take a moment to complete that. I think it'll just take a minute or 2 of your time. There is also a brief 3-month touch point survey. So that comes out 3 months after today's webinar, just because we like to check in and see if there's any kind of longer term impact of these types of events. So just keep your eye out for that. Again, we did record today's webinar, and we will share it in a follow-up email, and it will be available on our website along with a copy of the PowerPoint slide deck. So if you want to pull any resources or examples or contact information, that'll be easily available there. You can also always contact the staff team if you wish. Next slide. And finally, we did just want to share contact information for Engaged. And you can find our website that I've mentioned earlier, engagingolderadults.org, which will really link you to all of this other contact information that we have listed as well. So you don't need to jot it down here in this brief second left, but if you can navigate to engagingolderadults.org, you will find everything you need. So with that, I want to thank our presenters. We really appreciate your time, and also everyone on the line today. I hope you have a great rest of your day. Take care, everybody.